Hi guys, right, I just wanted to do a quick video just about occupational therapy and where we come from. Lots of people don't know what occupational therapists do, and some people just think that everybody can do that job, and that is not right. So I wanted to clearly kind of explain what it is in this quick video. So there's a process of how our bodies develop, and it's a neurological process. And if we don't have a basis of our sensory systems working in collaboration, then there are lots of difficulties that can occur. This is a great example of it. So we've got our central nervous system at the bottom. It's like a pyramid. Teachers come in up here where the intellect is. So that's where the academic learning happens. That's where the kids are independent with their daily living skills. They can get changed for PE. They can brush their teeth, anything like that. And that's where the behaviour happens. So if they learn socially, I can behave like this in this school, but this is what I've got to do. That is where the cognition happens. That's where the learning happens. But can you see that's right at the top of this pyramid? And there's lots of other elements that have got to happen before any children can get to that point. So if a child develops naturally and their sensory systems are working in collaboration, then that is where everything else happens. So your sensory motor system happens, your visual ocular motor skills happen, your eye-hand coordination comes into play, your motor skills, your planning, your bilateral skills where you can use a knife and fork together, you can zip up a zip. Things like that is all bilateral skills, and that's all part and parcel of once your sensory system's in place, you're then able to coordinate your motor movements. You cannot have good fine motor movements if you don't have good gross motor movements, and that is the top and bottom of it. So anything like that. And then language skills, if language skills, auditory language, listening, visual perception, anything like that, if those language skills aren't developing, then they're going to have issues with the academic learning as well. So it all kind of adds up, and it all impacts on their academic to learn in school. So if their sensory system's not working, imagine yourself in a meeting at work, or you've been on a course and it's a bit boring. So we've all been there. And what do? If you're sat and you're on a course or you're in a meeting and you're bored, what do? So we'll have the doodlers. We'll have the people who might eat. So you'll eat or chew. We have this swinging on your chair, getting up and going to the toilet, coming back. These are all behaviours related to your sensory system. And although consciously you aren't thinking about it, that is what you are doing. You are doing activities to help your nervous system, to help you get your attention and concentration back. And we know these socially appropriate activities, and we have the cognition and the impulsive control to be able to do it. Some of our children don't have that ability, that social awareness, that cognition to be able to do that. And that is why naturally their body, they can be sensory seeking, because they are looking to be able to kind of regulate themselves. So it doesn't matter if you've got a child who needs a lot of movement, there might be other issues within the sensory system, because it's like a building block. You've got a lot of blocks there. You need to have all the blocks in place before you can get up to here. And that is where OTs come from. We come from this angle down here. We look at all the sensory systems, and then all of this impacts on the mental health. Our arousal heightens when we're anxious. That means our sensory systems are functioning differently when we're anxious. So that means using sensory strategies, and if we can, cognitive strategies to help manage anxiety. That is where OTs come from. And this is just obviously a little short snippet of a video talking predominantly around kind of the sensory systems. But this is just one approach us OTs can use. And that is why people get confused about what we do, because OTs have so many different approaches they can use, and depending on additional training, like I've got advanced training in cognitive behavioural therapy, so I can come in and bring the cognitive behavioural therapy more as a dominant approach if I feel that's necessary for that child. So it's things like that, and I just wanted to explain kind of where we come from. So teachers come in here, us and speech and language therapists come from a step before that. They need all of these working in place before the academic learning can take place, and that is why we promote activities and try and integrate activities into the daily routines, into the lessons, into the learning, for the child to be able to focus, learn and be successful in their academic learning and their independence and life skills. So I hope this gives you a quick overview. If you've got any questions, just pop me an email or send me a message on Facebook or Instagram at wishingwellot@gmail.com, and I'll get in touch with you. Thanks. See you soon.